Hi class, so I'm going to talk about pregnancy, labor, and parturition. Pregnancy is a term used to describe the period in which a fetus develops inside a mother's womb. It usually lasts about 40 weeks or just a little bit over 9 months. There are 3 segments to pregnancy, and these are called trimesters. The first trimester usually covers the weeks 1, which is after the last menstrual period, and then up to 12 weeks. This is when the fetus is conceived and takes shape from the zygote through the stages of embryonic life. All the fetal organs are formed during this phase. The fetus is called an embryo from the first week through the 12th week after the last menstrual period. The second trimester is week 13 through 28. This is when the organs begin to grow to size and assure their characteristical shape. Morning sickness of the pregnancy begins during this phase. It starts to usually goes between the middle of this period. Quickening is usually felt during the second trimester, which is usually movement that the mom can feel. Sometimes it feels like a butterfly feeling at first, and then later on during the pregnancy, it'll feel more like a strong kick. During the third trimester, this is usually week 29 through 40. This is when the baby begins to grow and develop at more of a rapid rate than the beginning trimesters. Mom may feel more breathlessness as the uterus begins to grow. The baby rises to fill more of the abdomen, pushing up on the diaphragm, making it harder for the mom to catch her breath. Towards the end of the period, this is when the fetus is considered full term and can live outside the mother's womb. Typically, labor starts to set in and the baby is born between 37 and 42 weeks. The next phase is labor. This is the process for which the fetus and the placenta are delivered through the uterus through the vagina. It is a unique experience. You can have vaginal birth as well as a cesarean birth. I'm going to talk about the vaginal birth. There are 3 stages of labor. First, this is when the cervix begins to open up to 10 centimeters dilated. The second is when the baby moves through the vagina and it's born. Third is when the placenta or the afterbirth is delivered. There are different signs that a mother is in labor. First off, she starts to have contractions that are regular, and they start closer together than at the beginning phases of labor. She can start to leak fluid or have bleeding from her vagina. She's got a low dull back pain, and then also abdominal cramps. Management of a normal labor is during labor, a mother will be put on a cardio tachographic, which is monitoring that is used to monitor uterine contractions. Usually you see they have the straps around the abdomen, and then they can monitor the contractions, and then also the baby's heart rate. The vital signs are normally taken regularly while the mother's in labor. They'll usually get blood work done. Cervical exams are usually performed every 2 to 3 hours unless concerns arise, and then they'll check her more often. Analgesic there's different ones that can be used. IV opioids, inhaled nitrous oxide, actual analgesia is actually appropriate for most patients. Oxytocin can be initiated to augment contractions that are inadequate, just to help speed along the labor process. And then parturition means childbirth. Childbirth is the accumulation of the pregnancy. This is when the baby grows inside the mother's uterus. There are 4 different phases of this. First off is the dilation of the cervix, which is considered the mouth of the uterus. Second is the delivery of the baby. Third is the afterbirth, where you push out the placenta. And then fourth is recovery after delivery. Parturition comes from the Latin word parturire. It is to be ready to bear young. Thank you.